even though you might not have the symptoms outwardly. And not everyone goes through menopause naturally. Some people go through it surgically. So will you talk about the stages of menopause and how to recognize it and what it is?
So menopause, 2 definitions: 12 consecutive months, no bleeding, or an elevated FSH, the menopause hormone. It's when your estrogen and testosterone, you heard me correctly, plummet, so the FSH goes up. And so your doctor can either diagnose with 12 months, but my patients don't wait that long. They're like, I'm not struggling, I don't blame you. Or we can get an FSH test, like at LabCorp, Quest, we draw it in our office. So there's 2 ways to diagnose. Average age in the United States is 51, 34 symptoms head to toe: hot flashes, vaginal dryness, weight gain, word finding, brain fog,
joint
decreased
pain,
libido, frozen shoulder,
hives,
orgasm issues,
itchy ears.
Itchy ears. I mean, the guy behind the bar is like, oh my God, no. It's a party.
It's also sexy.
So perimenopause is menopause's twin, can have all the same symptoms, can start 10 years before, but the only difference between the 2 is the bleeding. There's still some bleeding going on in perimenopause. It doesn't have to be regular. You're never done with menopause. It's a permanent state. Like, it doesn't mean you're symptomatic. I say if we're lucky and we live long enough, yes, we will go through menopause. My patients are thriving. They're having sex. They don't have brain fog. They're not worried about pregnancy. I mean, they're at the best of their lives and their careers. I am a thriving 48-year-old woman who's not going anywhere yet. I don't want to be the 900,000 women that leave the workforce because of, undiagnosed, untreated, menopause. And so postmenopausal and menopausal, that's where people get confused. The only reason we talk about postmenopausal in medicine is because we want to talk about the bleeding. So perimenopausal bleeding, less concerning to us. Postmenopausal bleeding, we want to make sure there's no cancer, polyp, fibroid, something else that's going on. So postmenopause doesn't mean like you're done, you're not going to have symptoms. There are studies that show you can be symptomatic for 20 years plus if left untreated. There are women that have 0 symptoms. My mother doesn't understand how I build a whole business on menopause and sexual health care. I mean, she paid her dues with the cardiovascular stuff, but no nothing. She's like, I just stopped my periods one day. That's what she said. I was like, okay, that was her menopause story. But no, so not everyone's symptomatic. We know that there are differences in ethnicities. So minority women like myself can have much more severe vasomotor symptoms. And the other thing that I want to tell you guys, the reason it's way beyond a hot flash is that it can wreck marriages. I've seen people lose their marriages, their jobs, and really their homes, but it can also be a predictor of more severe disease. Did you know that it is a sign for us, those of you who have more severe vasomotor symptoms, you may have increased risk of cardiovascular disease. So don't let those doctors blow off those symptoms because we may be delaying a diagnosis that could be life-threatening.